Good morning to all. My presentation is on Niosomal formulation for dermal delivery of capsaicin. The first slide is about introduction and need of the study. Rheumatoid arthritis is the targeted disease. By definition, is a chronic systemic inflammatory disorder of joints characterized by joint pain, stiffness, redness, swelling, and decreased movement of the affected joints. NSAIDs are the first-line therapy for the treatment of rheumatoid arthritis. Though these drugs provide the relief of pain and inflammation, but long-term use results in untoward effects such as cardiovascular complications, renal morbidity, and gastrointestinal ulcers. Hence, focus is shifted towards natural agents such as capsaicin due to their documented safety and efficacy. However, the drug shows poor patient acceptance in terms of skin irritation, burning sensation, and poor pharmaceutical acceptance in terms of poor viability due to poor solubility. Therefore, Niosomal drug delivery system of capsaicin gel was made to overcome above shortcomings and enhance therapeutic effectiveness by controlling the drug release for a prolonged period of time. This is a picture of damaged joint due to rheumatoid arthritis, and this is a picture of Niosomes where both lipophilic and hydrophilic drugs can be incorporated. This slide is about objectives. The present research work was planned with the objectives of first, formulation and evaluation of Niosomes of capsaicin for dermal delivery. Second, to study the rate and extent of penetration by in vitro diffusion studies and to select the optimized formulation. Third, to compare the pure capsaicin gel with the optimized prepared formulation by in vitro diffusion studies. Third, the slide is about methods and results. 1. Preparation of Niosome by ether injection method. Solution of capsaicin 25 mg drug, 100 mg of span, 60 non-ionic surfactant, and 100 mg of cholesterol were taken into a 14 gauge needle, and 1.3 ml per min injection volume was maintained and poured into a beaker having warm water. Magnetic stirrer temperature was set at 60 degrees centigrade. The Niosomes were formed. This slide is about methods and results too. A 3 to the power 2 factorial design was used to study the effect of independent variables such as cholesterol concentration and concentration of surfactant on the dependent variables such as particle size, percentage entrapment efficiency, and PDI. Measurement of particle size and polydispersity index PDI. Capsaicin loaded Niosomes, particle size and PDI were characterized by particle size analyzer, model Malvern Jita Sizer Nano S90 UK. Distilled water was used as medium. This is a result chart, where result graph where we can see particle size 640.1 nanometer and PDI 0.010 respectively. The slide is about methods and results. 3. Entrapment efficiency. Capsaicin loaded Niosomes were taken into centrifuge tube. Then centrifugation was done at 10,000 RPM for 90 minutes. Then the sample were analyzed through UV spectrophotometer at 279 nanometer. The formula for calculating percentage entrapment efficiency is CT minus CF divided by CT into 100, where CT is total drug concentration and CF is unentrapped drug concentration. The entrapment efficiency of the formulation F5 was found to be 95.2%. 3 to the power 2 full factorial design was used to formulate formulation from F1 to F30, where cholesterol concentration and surfactant concentration were taken as independent variable, and particle size, entrapment efficiency, and PDI were taken as dependent variable. After evaluation of the dependent variables, F5 formulation found to be the optimized one. In vitro release studies of F5 formulation was carried out by using dialysis bag method. In the dialysis bag, capsaicin Niosomal suspension was loaded and phosphate buffer solution pH 7.4 was the media. Magnetic stirrer set at 37 degrees centigrade plus minus 0.5 degrees centigrade with 50 RPM. This is a comparative in vitro diffusion studies graph where percentage drug release from pure drug and percentage drug release from F5 formulation were compared. F5 formulation release order kinetics. When in vitro release data of F5 formulation was fitted into various kinetic models, it was confirmed cross-Meyer-Pepper's model. The equation is log mt divided by m infinity equals to log k minus p plus n log t, where md equals to amount of drug release over time t. M infinity is amount of drug release after an infinite time, here after 8 hours. K minus P equals to Cross-Meyer-Pepper's rate constant and equals to parameter indicative of the drug release mechanism. In the Cross-Meyer-Pepper's model, we can find R square equals to 0.9919. This slide is about methods and results 5. Same studies of F5 formulation. F5 formulation, same images were analyzed into three different magnification: 1000 magnification, 3000 magnification, 6000 magnification. Preparation of capsaicin loaded niosomes into gel. 0.025% weight by weight capsaicin niosomes from F5 formulation were added into a gel formed of 1.5% weight by volume carbopol 934 and pH adjusted triethanolamine 0.9% weight by volume. Then it is designated as F5NG, that is F5 Niosomal gel, which is again evaluated. Evaluation parameters PAR, pH, spreadability, homogeneity, viscosity, extrudability, and the result pH is 6.74 plus minus 0.04, spreadability 15.34, homogeneity homogeneous, viscosity 4320, extrudability satisfactory. This slide is about methods and results 6. In vitro diffusion studies of F5NG was carried out by using French diffusion cell apparatus with dialysis membrane, and in the donor compartment capsaicin niosomal gel was kept, and in the recipient compartment and phosphate buffer solution PS 7.4 was used as media. Magnetic stirrer with fixed speed 50 rotation per minute tube for sampling. This is a comparative in vitro diffusion studies graph of drug solution, plain drug gel, niosomal dispersion, niosomal gel. F5NG release order kinetics. When in vitro release data of F5NG formulation was fitted into various kinetic models, it was confirmed zero order control release of drug. The equation is MT equals to MB plus K0T, where MT equals to amount of drug release over time T, MB equals to amount of drug in solution before release, usually 0, K0 equals to or is zero order release rate constant. In the zero order model, we'll find R square equals to 0.9899. Summary: capsaicin loaded niosomes F5 optimized formulation prepared by ether injection method showed particle size 640.1 nanometer, PDI 0.010 and entrapment efficiency 95.2%, along with sustained release up to 24 hours. F5 formulation was selected further for same studies and gel formulation. The prepared topical gel showed spherical particles with pH of 6.74 plus minus 0.04, satisfactory homogeneity, spreadability, and viscosity. In vitro diffusion profile of F5NG was performed and drug release data were fitted into different kinetic models, which confirmed zero order control release model. Conclusion: thus, it can be concluded that niosomal gel represents a promising particulate carrier system having control release of capsaicin for rheumatoid arthritis. Future prospectus animal study to be done. To be done. Thank you for listening me.